If you watched my last video on knee osteoarthritis, you learned the initial exercises to improve the mobility of your knee, reduce some of the inflammation, and get moving better. If you want to continue to manage that arthritis and reduce, slow, or even stop progression of the symptoms that you're having, you need to also continue to work on progressively increasing your strength training. I'm Dr. Ryan, physical therapist and knee pain specialist here at Precision Fitness Physical Therapy, and today I'm here to show you the exact protocol that I use with clients in their 40s, 50s, and 60s that have knee arthritis but don't want to give up the activities that they love. Today we're going to go over some simple strength training progressions that you can do, and don't worry if these exercises are a little bit too advanced or causing you some pain or discomfort. We're going to talk about some modifications, but we're also going to talk about an alternative option called blood flow restriction training that helps you lift less weight and still make good progress with your strength and not put as much load through your knee, which might also be a good option for you. Let's dive in. Before we dive into these exercises, you need to understand why progressive overload strength training is the single most important thing that you can do to help manage your knee arthritis. Research has shown that strength training continues to improve your function, decrease pain, and prevent further progression of knee arthritis. Your quadricep strength is directly correlated to the load going through your joint. The stronger your quadriceps are, the more the load is distributed and the less pain there typically is in the knee. The weaker your quadriceps are, the more pressure goes through that knee joint and the more you are likely to feel it. The key here is progressive overload. What I often see people do is they're doing a couple body weight exercises like wall sits, regular squatting, lunging, knee extensions, and they're using light ankle weights, just body weight without any progression, and they continue to do the same routine over and over and expect to continue to get results from that. Your body is going to adapt to the exercises that you do. So if you keep doing the same thing over and over, your muscles don't continue to get strong, and while you might be maintaining some of your current function, you're not going to improve and that pain can come back. So we need to find exercises that you can initially tolerate that aren't increasing your pain and slowly progressively increase them so that you're actually improving the strength of those quadricep muscles and reducing the loads on the knee. So we're going to go over 5 exercises today that you can do to help manage your knee arthritis. The key here is making sure you're picking a variation that you can do effectively that is going to give you fatigue. So you're going to leave feeling like you really did a lot of work. Those leg muscles are tired and maybe even sore the next day, but not causing achiness or pain in the knee joint itself. And then the next step is to make sure you're progressively overloading week after week. So we either need to increase repetitions, increase load or weight, or decrease the speed at which you're doing them so that there's more time under tension for that muscle, as long as those are not causing increases in pain in the knee. So we're going to talk about a soreness rule that you're going to follow to make sure it is not increasing your knee arthritis pain as you are working. So as long as you are managing under a 0 to 3 out of 10 pain or discomfort throughout your exercise, and it's not increasing beyond that, that is okay to work through. But if you're going on to set 2 or 3 and your pain starts to go from a 3 to a 5 or a 6, that's probably a little bit too much and is going to leave you sore or achy in the knee the next day. If you're staying in that low, like 0 to 3 range, and it kind of stays throughout or gets better as you are going through the sets and the exercises, that's generally a safe range to stick within and shouldn't leave you sore and achy in the knee the next day, but should leave you feeling sore in the muscles themselves, which is what we're looking for. First up, we're going to start with a simple wall sit. I want you to get your feet far enough away from the wall that when you go down into the wall sit, your shins are about perpendicular with the ground. You're going to find a depth that you can do that doesn't cause achiness in the knees, but feels like the quadricep muscles are working. You can go all the way up to a parallel angle so that your thighs are parallel to the ground. That is going to be the hardest variation, and you should feel a strong contraction in your quadricep muscles here, but not necessarily pain in the knee. Try not to hold on to your thighs as you hold this, and we're going to start out with a 20 to 30 second contraction and build up that time. The key here is to make sure your feet are not too close. That is going to put a little bit of pressure and discomfort on your knees. And then you also want to find a variation that is challenging. So for many people, this is going to be way too easy, and oftentimes they don't challenge themselves enough. And then for many people, they're going to make it way too hard, and that's going to start causing pain in their knees. So find a depth that is challenging for you to hold for 20 to 30 seconds to start. And we're going to do repetitions of that. Over time, you can either increase the time that you're holding this for or decrease the depth. Once you're at this parallel position, then just focus on increasing time, and eventually we'll work up to doing regular squats. For those wall sits, let's focus on 20 to 30 second holds for 4 rounds during weeks 1 to 2. Then in weeks 2 to 4, I want you to increase either the depth or the hold time. So if you weren't as low as parallel, try to go a little bit lower as long as it doesn't bother the knee. If you can't do that, then we're going to increase the hold time by 5 seconds per week if you are able. And then in the following weeks, we're going to work all the way up to a 60-second hold, trying to increase 5 seconds per week. Or if you're not able to go any longer, try to increase the depth and maintain the same hold time again, as long as that is not bothering the knee. So next up, we're going to start with some single leg knee extensions. A lot of people fear this exercise. They think it's bad for their knees and that it's going to cause them more pain or cause breakdown in their joint. And that is not true. This is actually one of the single most important exercises you can do to improve strength in your quadricep muscles. So let me give you a couple tips to make sure you're setting this up correctly and dosing it appropriately, that it's not causing any issues. So we want to make sure you're scooting all the way back on the machine, that the crease is here. You're seated nice and upright, grabbing onto the handles on the sides, and that the bolster at the bottom is set up at your ankle. Now, sometimes people with knee arthritis are going to have pain in the last 30 degrees of that knee extension. If that is you and that's the case, then we're just going to go from a 90-degree to about a 30-degree position in the knee and avoid that last little bit of extension. But I want you to really slow this down. So think 2 to 3 seconds on the way up plus 2 to 3 seconds on the way down. As you are going through this, you're going to start getting a lot of fatigue through the quadricep or thigh muscle in the front here. And as long as you're not having pain here, that's a good sign, and that's what we want. So we're finding a weight that you can do about 12 to 15 repetitions of without having that pain in the knee, and that you're pretty fatigued by the time you hit that 12 to 15 repetitions. So if I'm pumping out and swinging these like this, I'm not going to get much out of this. If I'm hitting those 15 repetitions and I feel like I could do another 10 or even another 5, you should be having 1 to 2 repetitions left in the tank by the time you're done with the 12 to 15 reps, if you selected the appropriate weight. Now, if you are able to go through that full extension, you should be doing that and using the entire range of motion. That is going to be most beneficial for this exercise. Now, during those knee extensions, if you find no matter what weight you use, doing single leg is just not doing it for your knee and you're having too much pain, try to use both legs. Go out with both legs. Are you able to just lower with one leg at a certain weight? And if that's still too painful, then just start with both legs for this exercise and slowly build to the point where you can do one leg at a time, isolating that leg that's a little bit weaker or having the problem, or just doing single leg separately on each side for the most benefit for that quadricep muscle. Next up, we're going to do the opposite. So we're going to do a hamstring curl exercise. Most gyms will have a machine where it looks similar to where you're sitting facing forward, and this leg will just be pointed out and you're going to pull it down. Right now, I don't have one of those in front of me, so I'm just going to demonstrate. Sometimes you'll find standing curl machines, or ones where you're laying face down. It doesn't necessarily matter which one you use. You just want to make sure you're going through that full range of motion, feeling this in the back of the leg and not having any pain in the knee as you're doing this, and really trying to isolate and fatigue with that same repetition range that we were talking about for the knee extensions, starting with a weight that is challenging for 12 to 15. By the end of that third set, you shouldn't feel like you could do more than 1 or 2 on that last set. Next up, we are going to grab a weight and do some goblet squats. You're going to hold this weight in front of you, keep your chest nice and tall as you go down. We're going to start with a lighter weight and try to kind of do a slow tempo, just like we were doing for the knee extensions. So we're going to go 3 to 4 seconds on the way down, 3 to 4 seconds on the way up, and you should feel this in your quadricep or thigh muscles. If you're doing this and you're having pain right off the bat, take a look at this modification. If doing the goblet squats was causing you pain, we're going to pop your heels up onto weight plates or textbooks, something in your house that is thick but not going to move, that's about 1 inch to 2 inches off the ground, and then we're going to retry those squats. Oftentimes this takes enough load off of the knee, but really allows you to continue to feel those quadriceps as you're going, and you're going to find a depth that you can do that is not causing pain in that knee. So that might only be going down 2/3 of the way, 1/3 of the way, or to a full depth as you are doing this. And you want to continue to maintain that nice slow tempo on the way up and on the way down for 12 to 15 repetitions to start. Next up, we're going to do some reverse lunges. I want you to grab onto a weight or start without any weight and make sure that this is not painful. Hold on to something that you can use for balance, and then we're going to reverse lunge down to the ground and back up. If you're not able to go that low, then you can modify the depth. But what I want you to do is make sure you're keeping 80% of your weight over the front leg that is working. Notice how my chest is nice and tall. I'm hinging my hips back just a little bit, and I'm keeping weight shifted slightly forward. So my chest is tall, but it comes forward as my butt goes back. I'm coming down and then tapping and coming back up. You're gonna feel that in the front of your quadricep or thigh muscle here. If I take a really large step back, shift my weight back here, and then go down, I feel this all in my back leg and in my glutes, and we're not gonna get the intended benefit out of it. So make sure you are keeping your chest tall, but slightly forward, tapping, coming back up. Same thing, we wanna work on a slow tempo here that you can hold, and make sure that your knee is not caving inward a ton, not going outward a ton. You want to think about keeping your knee over your second and third toe or whatever is comfortable in that range, and that you're nice and stable throughout this motion. With these lunges, we want to find a weight that is challenging to get through 10 to 12 of them. As you are doing this, you shouldn't have any pain in the knee. If you do, make sure you modify that depth or just start with some of the other exercises. This is probably one of the ones that might be the most aggravating of all of them, but you should be able to find a range of motion, even if it is going through a quarter of that lunge, and still get good strength training out of that quadricep muscle. So for all of these exercises, whether it be the goblet squats, the knee extensions, hamstring curls, wall sits, or the lunges that we just went over, the most important thing is progressive overload. If you pick the same exercise, the same weight, and the same reps, and do that week after week forever, eventually your body will stop adapting. So you need to make sure you're picking an exercise variation like we went over that is not causing pain in the knee, but as your knee adapts and progresses to it, try the next step, whether that be going through the full range of motion. So think about in weeks 0 to 2 of this program, just finding weight that is not painful or range of motion that is not painful. Then the next thing would be to increase through full range of motion or more of that range of motion over weeks 2 to 4. If you're already going through the full range of motion, try adding just a few pounds or a couple of reps until you're in that 12 to 15 rep range. Once we're beyond that first month, that 0 to 4 week range, then in those weeks 4 to 6, we want to start continuing to increase the load a little bit, but dropping the reps down to 8 to 10 range. And then when we're kind of in that 8 to 10 to 12 week range, our goal is to get to 3 to 4 sets of 8 repetitions at a weight that is challenging, that you're just barely able to finish 1 or 2 more reps by the end of that third set. If you continue to progressively overload that joint in a way that is not spiking up pain levels, that is going to be the best thing that you can do for your knee to make sure you're continuing to strength train and adapt to all of the changes and loads that are going to occur throughout life. So in summary, progressively overloading and strength training your quadricep and surrounding muscles is one of the most important things that you can do for your knee arthritis. If you weren't able to tolerate some of these exercises, make sure you go back and watch the first video I have on improving your mobility and reducing your pain, and download our free knee mobility ebook that will be pinned in the comment section below. It goes through all of the mobility exercises you need to do to make sure you have full range of motion in your knee first before attempting some strengthening exercises. I also promised I would talk to you about blood flow restriction training. So BFR, or blood flow restriction training, is something where you put a specialized device around a leg like this, and you plug it into a device that monitors the pressure while you are exercising. And what it does is decreases the amount of blood going in and out of the leg during that exercise in a safe way. There's been plenty of research done that shows it's a very safe technique for the right people. And what it does is it allows you to strength train and make progress as if you are lifting heavier weights at 50 to 60% less load than you would otherwise be using. So this really is a game changer for people that have arthritis in their knee and have pain during exercise, because it allows us to strengthen that quadricep, which we already talked about how important that is, without necessarily causing that pain in the joint itself. This is not a program that is really recommended to do do by yourself because it can be dangerous if applied incorrectly. If it's something that you want to look into a little bit further, click on the link below. We have an application for our BFR program to see if it's the right fit for you, and we can set up a free discovery call to discuss that as well. Be sure to stay tuned for part 3 of this video, where we're going to go in a little bit more depth as to how to use blood flow restriction training to help manage knee arthritis, as well as what to do if you get flare-ups during a training process like this, rather than stopping and giving up, so that you can better manage your knee pain and your flare-ups. Because when you have arthritis, it is not something that is completely going away. Learning to manage flare-ups is going to be the best thing that you can do, rather than completely stopping your training program and losing progress along the way. If you found this video helpful, I want you to hit that subscribe button, comment with any questions that you have below, and if you have any friends that are struggling and dealing with this, make sure you send them this video if you found it helpful.